I naturally believe people are not naturally bad or evil or things like that, but the system makes it easier to do certain things. So would you be able to maybe elaborate a little bit more about what you've seen on a systems level and how those incentives kind of push the needle, I guess, in a way?
Yeah, happy to. So it can push the needle in a few different ways. So one is like the more like nefarious kind of version, which is, let's say you created a billing code for secure messaging and you said, we will pay you $20 for every time do some sort of secure messaging interaction with your patient. If you send them a smoking cessation, bit of feedback, smoking cessation advice, and they reply to you, we'll pay you. And when you do that billing code, and it all sounds very nice, but in doing that billing code, you forget to create a restriction which says you can't just message 10,000 people at once. You forget to do that. And
Yeah.
so it is possible for someone to send 10,000 secure messages at once and bill it for 10,000 times. If you make that mistake, there will be some number of doctors who will do that. This isn't a thing that's happening.
Yeah,
This is a made up scenario,
of course.
but someone will do that. That will happen. And there are I don't like that's not a real one, but like there are similar things in the past involving virtual care that I encountered where I was like, oh, you're not supposed to like bill this 17 times. You build it 17 times. Technically, you're right, but like that's not what this is for. And so there's that kind of thing where people will take advantage. That's the thing that government is often very, very afraid of. That's the nefarious one. And I consider the nefarious one very much on the margins. Government's scared of it because it costs a lot of money. If you look at like auditor reports of physician billing, you'll see these like radical outliers. But what's noted about the outliers is that like it's like 2% of doctors. Most doctors don't actually maximize to it. The much more problematic, tricky one at scale is when funding or billing incentives are structured in a way that using technology is either just not incentivized or disadvantageous. So if you imagine like a vendor comes to you as a hospital with a kiosk and is like, put this kiosk right like in front of your door. People come into your ER, will go to the kiosk, and the kiosk will ask them 3 questions and they'll answer it. And half the people will walk away from that ER and go back home. And it's actually 100% safe. We can validate this actually works really well. It takes care of half the people so that they never walk in your ER, reduces ER volumes by half. If it exists, one thing it does. There's ER triage things that are similar, but like this magic kiosk that actually is 100% accurate and diverts half people from ERs doesn't exist. But if it did, let's say you're a hospital, and you're told you can buy this kiosk for $100,000. If you do, your ER volumes are going to plunge and your funding is going to fall. You're going to lose funding over time. If that is how your ER, if your hospital funding is structured around like ER
Like volume
volumes,
with
if you based on patient complexity, whatever, if there's volume-based funding and all of a sudden as a hospital, this is a problem for you. And the same thing, you can kind of apply it anywhere in the system where, maybe secure messaging, or maybe remote monitoring is incredibly efficient for primary care provider. They can provide care to their 200 patients with diabetes with remote monitoring. It's cheap, it's easy, it works better, but they don't come in the door, and so you lose money. And all those different things where the amazing life-saving technology undermines your business model or undermines your operations or your livelihood, that stuff, asking people to be not nefarious. You're asking them to like give up their career. You're asking them to undermine their organization. And that's a hard ask. People have a hard time doing that. So I think there's a small sliver of people who are like actually nefarious. There's a small sliver who are like saints, who will do the right thing no matter how painful it is to them personally or professionally. But like 95% of us are kind of in the middle there, just responding to incentives and trying to like do the right thing, but also keep the lights on and keep food on the table and, keep having money to do fun things with. It's normal human stuff.